there. At the outset, I would like to thank you all for being present over here, taking out your time. I'm so grateful to you. Thank you so much. How many of you like to perform dentistry? How many of you would like to make a great success out of dentistry? By only few hands. What about others? I think if you are a dentist, and you should raise your, all of you should raise your hand. Am I right? Don't be shy about it. How many of you would like to, will be honest enough to tell me that dentistry is a hard science to perform? Thank you. Thank you. Hard science. Not the performance of clinical dentistry, but otherwise. Anybody can answer me what else you require to learn apart from clinical dentistry? Anyone? Not Nikita.
Not even you.
I'm asking students. See, this is going to be not one-way traffic. It would be more interesting if you all perform, speak with me. That is how your learning will happen. How many of you know that there are going to be challenges in performing your dentistry? Or you don't feel there are any challenges? Lots. Can you say one of them? What is the main challenge that you'll be facing?
Cost of equipment.
Pardon?
Cost of equipment.
Cost of equipment. One. Good. Anyone else? Setting up of a clinic. Great. Another one?
Patience.
Patience. Fine. Further? What is the topic of today's topic? So any idea, any one of you who has anything to do with business development, or do you consider dentistry as a business first of all? Anyone?
Yes.
Yes. Why do you say so?
There is only loss. There is no profit.
Well, that's another good answer. There's a loss. Why shouldn't there be a profit? I'll give you a brief background about me. Thank you so much for your contribution so far. I studied my first 4 years in a municipal school. My father could not afford to put me into regular school. So I studied from 1st to 4th standard in a municipal school of Mumbai Municipal Corporation. From 5th standard to 11th standard, that's how the education system was then. I studied at Marathi medium school where the fee used to be 5 rupees, 6 rupees, 7 rupees. Till my MBS, my father did not spend more than maybe max 10,000 rupees on my education. Today, how much of you people are spending? Imagine. This was right up to MBS. Now, as Dr. Gada said, we have one of the best clinics, we have the best equipped clinic, but still I'm practicing after 45 years of being in dentistry. Is that good? Is it a success? How did it happen? Was it by fluke? Was it by chance? Or was it by design? Please, I want you to participate. Now somebody said equipment is expensive. Somebody said patients are not there. Somebody said some other excuses. So what we are doing by giving such answers is we are looking outward for the cause of failure. If you have, I don't know whether people have seen the last 2-3 months ago a magazine published by Dent Care. Even the author has given a name to his presentation or the material that he has written in that particular magazine, Dark Days of Dentistry. Now he has enumerated all these causes that were mentioned by you all guys people over here. Then the solution comes from where? He says idea should do this, Dental Council of India should do this. This is not the answer. If you want to change a scenario, don't look for outward answers. What is essential is look inward, what you can do for yourself. Once you are out of this college, no one is going to come to your help except yourself. So what we are starting today is how do you practice your dentistry in a profitable manner? If you consider dentistry as only as profession, fine, that's a profession. How can you leverage that profession ethically as a business without getting into the finance of your life? I don't want to promote your practicing methodology by doing shortcuts. I have never done it. I get even trauma cases, orthodontic surgery cases, minor major oral surgery cases, dental implant cases directly to my clinic. I don't go and promote myself as a clinician anywhere. Neither you will see me in any IVF functions, neither will you see me in family functions. I'm a silent worker. This is the first time I've come out into the open to teach my fellow colleagues about the business aspect of dentistry, because that I've taken as a mission to help the younger generation. Build the dental business. Yeah, business aspect is good. How is it? Capital investment. Yes. Build your dental medical practice, but it is a business. Next. Now there's an equation here. This is related to your mind. T stands for thought, F stands for feelings, A stands for action. That leads to your results. Your thought, your feelings, your actions gives you results. The more the intense thought that you have to succeed, what may come. The emotions that go with it, strong emotions, positive emotions. No place for any negativity there at all. Then take properly planned actions will give you results, and those will have to be positive results because you have sown the seed of positivity. The moment you start talking about negative aspects of your life, about any profession, you will attract those negative emotions from the universe. So the next equation is P leads to T to F to A to R. P is what? Programming. You have a software in your body that is called as thought process. That is programming, which leads to your thought process, which leads to your feelings or emotions, which leads to taking actions and will give you results. Now, these were the findings of one person called Napoleon Hill. He wrote a book called Think and Grow Rich. Take the effort to read that book, hardly about 250 odd pages. It will change your life. Start learning something different from dentistry. You have spent enough time in dentistry, there's time for your personal growth, and start with this book called Think and Grow Rich. How do you think the title is? Think and Grow Rich. Anyone? Now, coming back to that particular equation, if that was so simple, thought to feelings to actions to results, Why can't everybody be a millionaire in this world? Anyone? What stops you people, or all of us, from not being so successful as we desire? Feelings. Feelings, yes, emotions. Fair enough, but what emotion? Predominantly which emotion? Negative. Please, yes, there. Fear. Fear is one emotion which pulls you down. And what is fear? Fear is a fantasizing an emotion experience which is appearing real. It is never in present. It's always in future. But what you are doing, you are anticipating the result as a failure. And if your actions are not proper, you are going to get failure. So coming to this particular understanding the business, now there is a self-employment. What does self-employment lead to? Is owner dependencies high or low? Let's finish this quick. I want quick answers. Self-employment is what? Owner dependency or no? Pardon?
Yes.
Yes. Action consistency is how much? Low or high? I've given you the answer there.
Fine.
High. Action consistency is low. Result and efficiency is only firefighting. I've been doing that. Nikita is a witness to it. We all do the same. No difference. Whereas, when you construct a business, there is a low owner dependency. The action consistency is very high. Results and efficiency are on the growth side. So what are the three ingredients of a business? It consists of team, systems, and strategy. Now what will team have? A committed team and a competent team. Systems should be simple and sustainable. Strategy should be magnetic and profitable. Fair enough? Any questions on this? What are the levels of business? Level 1 is a struggle and survival. These are the two stages. Level 2 is stability. Struggle and survival will take roughly between them around 7 to 8 years, 9 years, 10 years, depending upon the individual. Stability is followed 10 to 15 years. Level 3 success will be after about 15 to 18 years in your life. And then you scale. What is the purpose of setting up a practice or a business? What is your purpose of setting up a profitable business in dentistry? Why guess? Any answers? This is a different topic. I know you will not be able to understand what I am coming to. But this is what we want to orient ourselves. What is the purpose? Why are you getting into dental practice? Growth. Yes. Anything else? I think financial stability. Good. Next. What does a business owner think about? Profits. And the business owner thinks about scaling the business. And welcome, doctor. Thank you. Thank you for being present. She's my classmate. Now, the businessman's aim is always to scale the practice or the business to sell for profit, not sale to your practice, not profit to your practice. Once you have scaled it up, once you have made it a success, sell it or expand it. One or two. We'll come to that later. So what are the struggle and survival stages? In the struggle stage, primary focus is to get acquire patients, right? Then the consistent, constant investment is required, right? So where do you spend money on? Constant investment. Are you going to keep on buying new chairs? You will be spending money on setting up your practice. That is done as first capital investment. Then what you go for is your team development. You will have to keep on training your staff. You will have to keep on. See what is happening in this scenario. How many of you are in private practice today? Great. Around 15-20 people. How many of you have a regular trained receptionist in your office? One, two, probably three. One or others. So what are you people doing? Others are, you are attending to the telephone, you are attending to your patient, you are spending time. So you are doing firefighting. So if you don't build a team, don't blame dentistry for that. I'm serious about this. You have to delegate and create a team to work with you. Now, that's a different science. How do you delegate? That's a whole lot of different time management. We'll not be talking and touching that subject at all. The other part of your investment would be to do marketing. If you have set up your practice, including your premises, and the cost has come to roughly about 85 lakhs to 1 crore rupees, which is not small money even now, you need to spend minimum 8 to 10% of that capital that you have put in as a separate capital on marketing. Don't ask people to walk in through the door by looking at the board. You have to create value in the patient's mind that you are somebody who is not a part of the crowd. You are a leader of the crowd. What are you? Speak up. Leader of the crowd. But here in struggle, you have complete owner dependency. So you keep on performing and probably you'll put in about what? 30-40 hours a week. Maybe you're sitting, but you're still performing. So that's a waste of time. Your chair needs to be occupied or sat upon by a patient. So you need people to walk into your door, then you have to perform. Am I right? There are no systems. So without systems, the business will not function. Because economics, finance, everything has a basic law. And they work on systems. As my teacher says, systems work, people don't. What does it say? Repeat. Systems work, people don't. You have been given a system of doing an extraction. Since she's there, I'll talk about extractions. There's a system of doing extractions. If you go beyond the systems and break the system, what is going to happen? What is the result? A fractured tooth or a fractured clavicle. Worst case, that has happened. I have treated such cases. So then you rush to manual. This is what has happened, right? So don't break the systems, but create good systems. Average competency is low. What do you mean by that? If you are in the struggle phase or the survival stage, your competency is low. Yourself as well as your team. This normally takes to overcome this struggle stage 2 to 4 years time. Till then you have to keep on doing your hard work. So what is the survival stage? If you have crossed this 4 years, 3 years, 4 years, then you come to the survival stage. Still you are not making money. Somebody said there was no money. There's only losses, isn't it? There are bound to be losses. Don't expect day one to give you money. Now, on the survival stage, you have tested a multiple business model which gives more financial return. Now, the losses will start reducing. You will start getting the benefit of your marketing efforts. Very small team is managed by the business owner. Still the business owner is present and he is managing the team. Business and financial planning is going on. So still the money is going into the business and financial planning. That is the stage of survival. It takes about 5 to 7 years to reach that stage of survival. Most of us fall into that earlier stage, survival, me included. Now we come to the stage called as success. Stability and success, sorry. And stability, you have a profitable business, decisions on strategic directions are going on, increase in profits, versus sell the business or scale the business. Business owner drives functional teams. Now, here it's only the functional teams. If you have a practice where there are number of doctors working with you, number of consultants working with you, you are the owner of the business and you are driving these teams to function according to their ability, and you are in a situation to drive the business at this stage. It takes about 7 to 10 years post your stability stage, or survival stage. Now, what is a success stage? You have a rapid financial growth, you have complete true owner independency, so the doctor or the surgeon may not be present in the practice. It is high level of delegation. You have delegated the entire workload on your associates. You need not be there in the clinic. Business is driven by functional heads. So if you have an orthodontist coming here, an endodontist coming, a periodontist coming, and they're doing their job, or your assistants who are well trained and they're doing their jobs, you don't have any function. As far as the clinic running is concerned, business running is, yes, of course, you are the boss, but you need not be working on the chair. Operations are decentralized and run as independent units. Each and every, how the work happens when you go in the hospital, every department is separate. Every head is separate. Every person who is running the show is different. That is how you have to create your systems. Transformation to big business. Here the transformation will start happening towards big business. Big has no scale as such. You aim for that big and that big will be yours. Here, if you commit a mistake, we take you back to stability or survival stage. But this takes about 10 to 15 years post this. So roughly around 20-25 years in practice, you will be at the level of success. Next. So what is scaling the practice? Management is decentralized. Owner is non-existent in the business. He may not be there at all. He need not be, he should not be in the premises at all. He only gets the reports on the computer or something, that's it. How would you like that to happen? I'll give you one example. There's a dental surgeon in Texas who's of my age. About 12-15 years ago, he was frustrated, like all of us, and he wanted to quit dentistry. Then he met with a business coach and he developed those systems. He set one clinic from Houston, Dallas, wherever he was staying. There he started practicing again. And in the radius of about 200 kilometers, he has 4 clinics which are giving him about $500,000 per month. Big money? $2 million? Now is the question, after having learned all this, how much time should he be spending in each of his clinics? Any answers? How much time? Well, he spent some time. How much? Huh? He's 4 different locations. He can't be anywhere. Collect the money. No, that also is not required. It goes all that directly online into the bank.
Cystic. Cystic. Is endodontist in one clinic, orthodontist in another clinic.
So everything is systematized. It's all systematized. He spends only 45 minutes a month. And that too not in his clinics. He invites his entire staff of about 80 or 100 people to his home. He has a conference hall like this and he gives them their training and their targets. That's it. How many of you would like to reach that stage? Good. Good. At least there are two people who are really thinking positively. I'll give you another example. Is a physician, roughly around 55 to 58 years old, MD physician from Delhi, practices in Florida, USA. How many clinics he has, how many staff he has, and what is his gross collection per annum? 3 questions. Any guy? You know how a physician earns? How much a physician earns? Madam, yourself, your experience.
Actually, I don't really need business.
That's a separate issue. That is your lookup. But I'm just asking you a question. How much would a person be earning in USA as a physician?
It must be about 5 million.
5 million. Any other guess? This doctor has 86 clinics. 86. And he's of our country. He's from Delhi. No. He's not a dentist. He's a physician. MD physician. 86 clinics. 200 physicians. 900 support staff. And still he attends to patients Monday, Wednesday, Friday, 9 to 3, 45 patients a day. So he's not away from medicine. He's doing justice to his whatever learnings. His annual collection only $163 million. We are doing injustice by keeping our knowledge to ourselves. It is more important that we are spreading our message and our efforts to as many people as possible so they get the benefit of our skills and knowledge. Whether we consider it as a business or a profession or ethics or non-ethics, non-ethics is out of question. I've never done it. But when we are talking about money, it has to be business. No bank is going to give you loans at a lesser rate of interest. Nobody is going to work for you for free. Your staff is not going to do a charity to you. Your laboratory is not going to do charity to you. The government is not doing charity to you. They will say, okay, we will waive off your income tax. Does it happen? Just because your doctors have more and more taxes being imposed on us. Am I right or wrong? There's more harassment going on with the doctors today because we happen to be soft targets. Do we want to be a willing victim of that? Next. Now the stages of business, there's an aspiration stage. What is your aspiration? The limitation goals, there are aspiration goals. What do you mean by limitation goals? Supposing one of your practicing doctors is making about 10 lakh rupees a year. What would be your limitation goal for the next financial year? Anyone? What is your revenue goal? Come on. You are already making 10 lakhs. For the next year, how much should you be making? Double. Okay. 10 lakhs or 20 lakhs. What is the reaction goal? Somebody has hurt you. Okay. And then you say, तो मैंने इसके ऐसा किया क्या? I'll do that best to you. That is also another goal, which is a reactive goal, which is not a very positive part, and which is an aspiration goal. Now you have to have that particular aspiration, which is tremendously good to achieve. How would you do that? Where would you put your aspiration goal? A doctor gave a 20 lakh rupee goal for at the level of limitation goal. Now what would be aspiration goal? Anyone who is practicing here can give me that answer. In limitation goal, you are limiting your performance. In aspiration goal, this is the goal you would really love to achieve. What would that be? Unless and until you try to reach for the stars, then probably you will hit the moon. If the target aspiration is only the moon, probably you will hit only the ceiling. So the aspiration goal has to be very, very high, very, very enticing, very, very attractive, and it's a wow to achieve. So where would you put that? If I say today I'm making 10 lakh rupees and I want to make 1 crore rupees, would that be an aspiration goal? You set the limit. You can say मैं आज 10 लाख रुपया कमाऊँ तो मुझे 10 करोड़ कमाने हैं. Fair enough. Nobody is going to take you for the word that okay you go to earn 10. होगा नहीं होगा आपके ऊपर है. How you set the systems, how you perform, it's up to you to do it. Next. Then we have the team to be developed. If you have your staff, your doctors, your support staff who is working with you, you need to create the team aspirations, because unless and until they also are part of your goals, why should they work for you? What's in it for them? Isn't it? So unless and until you take care of your staff, you have trained somebody as a receptionist and you don't take care of her. And after some time when you have delegated a lot of duties and responsibilities to that lady, one day she says, and my husband got transferred, I want to go. These are exceptional circumstances, but in the worst case scenario, probably you're not given a proper raise, you're not given a proper incentives, and she quits. What happens to your practice? So it is very important to take care of your support staff. Patients. There are 3 stakeholders in this. One is a team member, one is patients. I covered the team. Patients. Well, why the patient should be coming at you repeatedly? Why is the patient coming to you once and going out? That is profitable. Or the patient keeps coming back to you over the years repeatedly. Is that more profitable? Are you learning something? Say yes loudly. What do you say? Patient coming once and going out of your practice? Or patient coming in repeatedly for different reasons? Not exactly you've done a root canal, you do a re-root canal. That's stupid. Isn't it? At the same time, the patient is so very satisfied that they bring in other people also. Isn't it more profitable? So you have to strive for patients who look for more value for money. They're spending money, right? They have to give them value. Otherwise, they won't come back. Now, what are the team aspirations? What is the aspiration of the business owner? As a business owner, I look financial growth, I look my brand growth, and I want to have time freedom. It takes a lot of your mental commitment to be performing dentistry after 45 years. It's not easy. Imagine yourself today, you are 25, 30-year-olds. Look at yourself 45 years down the line, and are you able to work? Think about it. Now, what does it take to be there? Physical condition, mental motivation. Again, a separate topic to discuss. As a business, when you're doing this business, there are aspirations. As a business also, there are business goals. Now, those are challenging goals and there are inspiring goals. When you say challenging, I do not know how to do business. There's fear involved. Instead, you say inspiring thoughts would be, what do I really want? That will start provoking a thought process of how do you reach to your business aspirations. And you create love amongst your own sphere of influence. Now, breakthrough objectives for the business would be financial, customer or patient-centric, team-centric, functional systems, and learning-centric. So these are all parameters for your business to grow. Now it comes to the analysis part of it. So what are the problems at the analytical stage? What are the problems? Anything that can come in the way of achieving your goals. These are doubts, fears, limitations, obstacles. These are all, some of them are internal, some of them are external. Again, there's a mind management that is required. Goals plus problems, you have no beliefs and no actions. You have goals and goals minus problems will create a belief of success, leading to your proper actions and giving you the proper results, the positive results. Now, in any organization, there will be problem listing. Unless and until you know what are the problems you will be encountering, you will not be able to solve them. Am I right? Now, when you are looking at your team, system, strategy, self, and boss, we have done this exercise in our clinic. And then it comes to root cause analysis. What is the root? Ultimately, you may have a lot of problems, but ultimately it comes down to boils down to only two. What is that? Motivation and marketing. You do everything, all the analysis you do in your business, ultimately it boils down to two main issues. Lack of motivation, business owner as well as the team, and lack of marketing. So you have to concentrate on these two. Next. Awareness stage. Now we have done the analysis stage, now we become aware of the problems. But there are three screws to turn to accelerate your performance. There should be clarity, competence, and culture. What is clarity? Clarity of your objectives. What is the competence? How you perform. What is the culture? How you are developing your culture within your organization. How open you are, how close-minded you are, how open-minded, how helpful you are, how much you take care of your staff. The bonding that you develop between them and yourself. I'll give you an example. One of our colleagues in our business development program, he has a warehouse in Ukraine. For some reason, the entire warehouse had a fire, the whole thing went into flames. He goes to the country, he's managing the whole thing, he does not have sufficient funds to reconstruct the business. Each and every employee of his comes to him and says, this is my $1,000, this is my $1,500, somebody said $20,000. One lady came to him and said, sir, I don't have money, but these are my home papers, you can mortgage this house and raise money. How many of us can create that sort of a team which is so much committed to ourselves? Amazing. So you have to develop those skills. So we have covered all this. Business aspiration goal we have done. Right business model we have done. You are doing systems, and then what is the team? Whenever you have a team, every member of the team will have to have certain roles to play. So the role clarity has to be there. Who's going to perform what? Isn't it? Without that clarity, they're not going to be, again, able to work with the team at all. And the last is their career growth. Career growth for every one of them is important, since they are also looking at their own personal growth. Now, these are smart business rules: specific, measurable, attainable, relevant, time-based. It will take about 4 to 6 months to create your business goals. Supposing we have a financial goal of 90 lakh rupees for annual revenue, you have to increase your revenue and cash flow month on month to reach that goal. Increase the number of patients by increasing services and treatments, volumes and cash flow. But then there is a customer-centric goal. You can try with other doctors. What I mean by other doctors is not, passing of the packets. No. Can you create a group which is a non-compete group? There's an ENT surgeon, there's a general surgeon, there's a direct, there's an orthopedic surgeon. Can you network among the medical community and create a group by which internal referrals can happen for the benefit of the patient? Can we create that? Is that possible? That's out of the world. Pretty well possible, isn't it? Create a wow experience for the patient, that is your hospitality. I'll just give you one example. How many of us really think about hospitality in our clinics? Anyone who's in private practice? Have you ever given a thought that the patient has come to you only for treatment and nothing else? If the patient is walking in your practice, give them a glass of water. If the patient has come into your clinic with sweaty and all that, give them a wet towel with the perfume. How will the patient react to such gestures? Or give a thank you card when you are visiting our clinic. Is it possible? It doesn't cost you a lot of money, right? But this is internal marketing. You are creating value in the patient's mind to come back to you because nobody else is doing it. Am I right or wrong? It's okay, yeah? Are you learning something? Congratulatory messages to your patients for their anniversaries, for their successes, for wedding anniversaries, exam passing, sometimes condolences for anybody who is passing away from their families. They also make a lot of impression. For the team-centric. In the team-centric, you have to be giving training to your staff. Unless and until you train your staff, don't blame dentistry for that. If they don't perform, you don't perform. Today you are in the atmosphere of an institution where everything is on autopilot. One doctor, one student will help the other student. That's how it happens. So when you go into your private practice and you don't develop a team, probably at that point of time, you will not be able to connect to the patient well because you are still in the firefighting mode. Incentives to the staff, bonuses for target achievement, these are also essential factors for team-centric goals. Functional systems marketing. I've just given a sample. There could be an internal marketing, there is an external marketing. Print, media, all sorts of things. Plus online marketing. Very powerful tool today. Learning, continuous education. Unless and until you keep on refining your skills, learning new skills, learning new topics, probably you will be left behind. You have to attend conferences, you have to attend seminars, and lectures like this, personal growth. personal growth is the most important aspect. I really wish I had this particular opportunity to do these particular personal growth seminars. That was probably 30 years ago, 35 years ago. I would have been somewhere else. So business systems, organization-centric, set, track and achieve goals. We have covered all this earlier. Competency-centric. Unless and until you are competent enough, your performance will be declining. So enhance the team competence, take high responsibility. Education, training, 2 hours a week you have to spend with your staff to train them. If a person is not able to hold a suction properly in their hands and the patient is troubled, don't blame the staff. Blame yourself because you have not trained the person. The problem lies with you, not the person who is assisting you. If you cannot teach, you cannot lead your team. That's how it is. Do we spend time? A business competency assessment, there are business function, goal, owner, dependency, action, results, yes, no. All you can think about it, marketing, sales, these are all the topics which have to be considered as far as the business competency assessment goes. Next. Competency iceberg model. Now how many of you know iceberg? Iceberg, right? How much is it visible above the waterline? 10%. Everything there. 10%. And what does it contain? As far as the iceberg model is concerned of competency, you have skill and knowledge which is measurable, which you can interview the person, find out about it. Alright? Which is only 10%. But what is below the water is the more important aspect of employing somebody in your practice. What are those? What is the self-image of the person? It's intangible. What are the traits of the person? What are the habits, traits, and attributes? What are the motives of the person? Why do they want to join with you? Again, you need to answer those questions or ask the questions to them. That is 90%. Unless and until this part is clear, the hidden part, one tends to get into some sort of difficulties. Yes? But action planning stage, you have, why don't we delegate? As a professional, why don't we delegate? What are the influence of delegating? What if she is not good at skills? So you want to retain the control in your hand, considering yourself to be one of the best. Right? Now this is a competency track. You all fall into that. What the patient may not like. You have to create confidence in the patient's mind that your associate is equally good as you are or even better than you. Certain subjects which you are not able to handle, certain treatments you are not able to handle, let the better person handle it. Now the fear is also, I will lose control over my organization. Another part is, I am so busy putting out fires, treating patients, doing consultations, that I will not have time to run the business of my practice. So one does not consider the business part of your practice because of XYZ reasons. So now we come to a particular later on understanding. How do we manage our practice? How do we go beyond this? There are certain methods that we teach to our fellow colleagues. There are 2 programs. One is of course the business models and development and training of business, of dentistry. How do Madam doesn't like the word business, probably. I'll call it a practice management, old fashioned. But it still remains a business. So those who would like to learn more about it, you are most welcome. And then another program called as Mind Management, Millionaire Mind Blueprint. It's written in your mind how much money you want to make. You can all find out that. There's a mapping for that. So if you wish to learn more about it, you are most welcome. What we'll be doing is, normally all this costing that comes for the training, this is going to be about 15 months training, 12 to 15 months of training, one-on-one basis or 2 or 3 people at one time. Sometimes it could be an online, sometimes it could be a Zoom call. But if I say that the entire one program will come to near about 1 lakh rupees, so 2 programs will come to 2 lakh rupees. For your person, now tell me, how much of money you spend on your continuous dental education? Anyone?